Respiration. Energy is the most important requirement of life. All systems require energy to work. The various processes carried out by body, such as movement, growth, and reproduction, all require the expenditure of energy. In animals, this energy can be obtained only from the food they eat. In the processes of cellular respiration, this food energy is made available for use of oxygen and the production of carbon dioxide. Oxygen enters into animal's body from air or water surrounding it. In the less complex animals, the oxygen is absorbed over the entire exposed surface of the body. In higher animals, however, there are special respiratory organs such as gills or lungs. Excess carbon dioxide is usually eliminated from the same organ. Properties of respiratory surfaces. The area where gaseous exchange with the environment actually takes place is called the respiratory surface. Gaseous exchange takes place in all organisms by the physical process of diffusion. For effective diffusion, the respiratory surface must have the following properties. It must be permeable so that gases can pass through it. It must be thin for efficient diffusion because diffusion is only efficient over distance of 1 millimeter or less. It should possess a large surface area so that sufficient amount of gases are able to be exchanged according to the organism needs. It should possess a good blood supply. There should be a good ventilation mechanism to maintain a steep diffusion gradient across the respiratory surface. Human respiratory system. Respiratory system provides the fundamental ability to breathe. The system consists of nose and nasal cavities, pharynx, larynx, trachea, bronchi, bronchioles, and alveoli, and the lungs. Nose. The nose is only externally visible part of the respiratory system. The structure of human nose is composed of bones, cartilage, and fibrofatty tissues. The external feature of nose depend upon the ethmoid bone and the cartilages. Hair are present inside the nostrils that help in the filtration of air. Hence, nose hair serve as a defense mechanism against the harmful pathogens and solid particulate matter present in the air. Both the nostrils and nasal cavities are lined by mucous membranes along with cilia. The mucous membrane secretes a sticky substance called mucus. The mucus and cilia filter the air and prevent the entry of foreign particles such as microorganisms, dusts, and particulate matter inside the respiratory system. The mucus also helps in moisturizing the air. Cilia move the trapped substances to the pharynx for their removal. Underneath the mucous membrane, there are blood capillaries that help to warm the air to about 30 degrees centigrade, depending upon the external temperature. Pharynx. Pharynx is cone-shaped passageway leading from the oral and nasal cavities to the esophagus and larynx. The pharynx is part of both the digestive and respiratory systems. Larynx. Larynx is an organ of complex structure that serves as a dual function as an air canal to the lungs and controller of its axis, and as the organ of voice. The larynx is composed of an external skeleton of cartilage plates that prevents collapse of the structure. The plates are fastened together by membranes and muscle fibers. Two fibrous bands called vocal cords are located in the larynx. The vocal cords are composed of mucous membrane stretched horizontally across the larynx. Trachea. Below the larynx lies the trachea, a tube of 10 to 12 centimeter long and 2 centimeter wide. Its wall is stiffened by 16 to 20 characteristic horseshoe-shaped incomplete rings that open towards the back and are embedded in a dense connective tissue. Trachea is lined with ciliated mucous membrane. The trachea serves a passage for air, moistens and warms it while it passes into the lungs and protects respiratory surface from an accumulation of foreign particles, bronchi. The trachea divides into two stem bronchi, one each for the left and ring and right lung. The right bronchus has larger diameter and is shorter than the left bronchus. Structure of bronchi closely resemble that the trachea. However, they have small cartilaginous plates to support their walls. The bronchi divide and redivide, forming an airway network in the lungs. Bronchioles. The bronchioles are located at the end of the bronchi and terminate in the alveoli. The bronchioles are approximately 1 millimeter or less in diameter, and their walls consist of ciliated cuboidal epithelium and a layer of smooth muscle. The bronchioles are the first airway branches that do not contain cartilage. They are responsible for controlling air distribution in the lungs. The bronchioles change diameter to either increase or reduce airflow. The bronchioles continue to divide and subdivide deep into the lungs. Eventually, the terminal bronchioles open into small collection of air sacs known as alveoli, where the actual exchange of carbon dioxide and oxygen occur. Alveoli. The alveoli form the gas exchange surface. The wall of each alveolus is only zero point 0.1 micrometer thick. On its outside is a dense network of blood capillaries, lining each alveolus as moist squamous epithelium. This consists of very thin, flattened cells, reducing the distance over which diffusion must occur. Collagen and elastic fibers are also present, which allow the alveoli to expand and recoil easily during breathing. Lungs. Humans have two lungs, a right and left, which are located in the thoracic cavity. Together, the lungs occupy most of intrathoracic space. The right and left lungs are slightly unequal in size. The right lung represents 56% of the total lung volume and is composed of three lobes: superior, middle, and inferior lobe. The left lung smaller in volume because of the symmetrical position of the heart has only two lobes. In the thorax, the two lungs rest with their bases on the diaphragm while their apexes extend above the first rib. Each lung is encased in a thin membranous sac called pleura. It consists of two tough, flexible, transparent pleural membranes. These protect the lungs, stop them leaking air into the thoracic cavity. and reduce friction between the lungs and the wall of the thorax. Lung volumes and capacities. Lung volumes and lung capacities refer to the volume of air associated with different phases of the respiratory cycle. The average adult human has lung capacity of approximately 5 liters, but only a small amount of this capacity is used during normal breathing. Tidal volume is the volume of air exchanged during one breath in and out in quiet breathing. This is about 500 milliliter. Residual volume is the volume of air remaining in the lungs even after a forcible expiration. This is about 1.5 liters. Control of breathing. Normally, breathing is an involuntary process and is not controlled consciously. However, some voluntary control is also possible. Involuntary control of breathing is carried out by breathing center located in the medulla oblongata. The ventral portion of the breathing center acts to increase the rate and depth of inspiration, and is called inspiratory center. The dorsal and lateral portion inhibit inspiration and stimulate expiration and form the expiratory center. The breathing center communicates with the intercostal muscle by the intercostal nerves and the diaphragm by the phrenic nerves. Rhythmic nerve impulses to the diaphragm and intercostal muscles bring about breathing movements. We know that breathing consists of two phases, namely breathing in or inspiration and breathing out or expiration. Inspiration, inhalation. In human, inspiration is an active process. During inspiration, the intercostal muscles between the ribs contract and pull the ribs forward and outward, pushing the sternum further away from the vertebral column. By the contraction of the intercostal muscles and of the diaphragm, the size of the thorax as a whole has increased, and the pleural cavities within it are therefore enlarged. Since the pleural cavities are closed, their enlargement tends to create a partial vacuum within them. The lungs are elastic and communicate with the atmosphere through the air passages, trachea, bronchi. As soon as the pressure around the lungs is lowered, the air rushes into them through the trachea by its own pressure and dilated them. In this way, the lungs expand to fill the pleural cavities and the pressure on the inside and outside of the thorax are equalized. Thus, the mechanism of human breathing as a suction pump mechanism. The lungs are made to expand and contract by movement of the ribs and diaphragm. Expiration, exhalation. Expiration in human is normally passive. In severe muscular exercise, however, expiration also becomes active. During expiration, the intercostal muscles of the ribs relax. The ribs move downward and inward. Thus, the size of the chest cavity is reduced from the side to side. The sternum comes to its original position, decreasing the size of the chest cavity from front to back or dorso-ventrally. At the same time, muscles of the diaphragm relax, and so the diaphragm assumes its dome-shaped position. Thus, the relaxation of the muscles of diaphragm and of the intercostal muscles, the size of the thorax as a whole has decreased and the pleural cavities within are therefore reduced. This reduction in the size of the thorax exerts pressure on the lungs. The lungs themselves are very elastic and tend to return to their original size. When the lungs are pressed, the whole air inside them is expelled or expiration occurs. Voluntary control within limits, the rate and depth of breathing are also under voluntary control, as is evident by the ability to hold the breath. Voluntary control is also used during forced breathing, speech, singing, sneezing, and coughing. During voluntary control, impulses originate from the cerebral hemispheres and pass to the breathing center. Mechanism of transport gases. Like other material, respiratory gases are also transported in various regions of the body by means of blood. The blood transports oxygen from the lungs to different tissues and carbon dioxide from tissues to the lungs. Transport of oxygen and blood. Approximately 97% of oxygen is carried by the red blood cells as oxyhemoglobin, while 3% is transported as dissolved oxygen in the plasma. At high partial pressure of oxygen, oxygen binds with hemoglobin, thus binding as a reversible reaction that occurs in the alveoli of the lungs in the presence of enzyme carbonic anhydrase. Each molecule of hemoglobin can bind with four molecules of oxygen to form oxyhemoglobin. The ability of hemoglobin to bind with oxygen is called oxygen carrying capacity of blood. The oxygen carrying capacity of blood is directly proportional to the partial pressure of oxygen Q2. Maximum oxygen carrying capacity of arterial blood is 20 milliliter. 100 milliliter of blood 100% saturated, which is achieved at 100 millimeter HgPO2. This is because the amount of hemoglobin is 15 gms per 100 milliliter of blood. Since 10 gram hemoglobin can combine with 1.34 milliliter of O2, therefore 100 milliliter blood combines with 20 milliliter oxygen 100% saturated. Normally, each 100 milliliter of arterial blood contains 19.4 milliliter O2. It is 97% saturated due to N95 mmHg, while 100 milliliter of venous blood contains 14.4 milliliter O2. It is 75% saturated due to S40 mmHg. Thus, 5 milliliter of O2 is released to the tissues by 100 milliliter blood. During exercise, the need of oxygen is greatly increased in the tissues, so more oxygen is released by the arterial blood to the tissues. The venous blood that leaves an active tissue has only 4.4 milliliter oxygen per 100 milliliter of blood. 20% saturated PO2 is 18 mmHg. Compared to carbon dioxide, oxygen is relatively insoluble in blood. Therefore, a small amount of O2 is transported and dissolved state in the plasma. Normally, each 100 milliliter blood contains 0.29 milliliter O2. Q2 is 95 mmHg, and this capacity may increase up to 0.3 ml per 100 milliliter blood at 100 mmHg Q2. while the 100 milliliter of venous blood has 0.12 milliliter of dissolved O2 PO2 as 40 mmHg. Thus, 0.17 ml of O2 is transported by each 100 ml blood through the tissues per cycle in the dissolved state. Transport of carbon dioxide. Carbon dioxide is transported in the blood in three main ways: in the form of bicarbonate ions, in the form of carboxyhemoglobin, and dissolved in plasma as bicarbonate ions. Approximately 70% of carbon dioxide is carried in the blood as bicarbonate ions. Carbon dioxide diffuses into the blood and combines with water to form carbonic acid in the presence of enzyme carbonic anhydrase. The chemical reaction can be depicted as follows: CO2 plus H2, H2, CO3. Carbonic acid H2CO3 is an unstable compound and dissociate to form hydrogen ions and bicarbonate ions. H2CO3 carbonic anhydrase H plus HCO3. Accumulation of H ions increases acidity in the blood. It leads to the decrease in the pH. This does not occur since hemoglobin buffers the hydrogen formed. The hydrogen ion readily associates with oxyhemoglobin to form hemoglobinic acid, and oxygen is released to the tissue. From inside the erythrocytes, negatively charged HCO3 ions diffuse to a plasma, thus balanced by the diffusion of chloride ions in the opposite direction, thus achieved by special bicarbonate chloride carrier protein that exists in the RBC membrane. This protein moves the two ions in opposite directions, maintaining the balance of ions on either side. This is called the chloride shifts or Burger's phenomenon. The chloride ions that enter the RBC red blood cells combines with potassium ions to form potassium chloride, whereas bicarbonate ions in the blood plasma combine with Na to form sodium bicarbonates. The blood pH is thus maintained at approximately 7.4 by the buffer mechanism that exists in blood. Transport of carbon dioxide depends on the partial pressure of CO2. In case the partial pressure of CO2 is higher in tissues than blood, the reaction process proceeds as drawn above. However, in case the carbon dioxide is higher in the blood than outside of the blood, as in case of the lungs, the equation reverses. The bicarbonate ions with hydrogen ion to release carbon dioxide and water is carbaminohemoglobin. About 23% carbon dioxide is carried as carbaminohemoglobin CO2 combines with the globin part of hemoglobin. The reaction depends upon the partial pressure of carbon dioxide. When the PCO2 is higher in the tissues than blood, formation of carbaminohemoglobin occurs when the PCO2 is higher in the blood than tissues. As in case of lungs, carbaminohemoglobin releases its carbon dioxide as dissolved CO2 in plasma. Only 7% of carbon dioxide is carried this way. This is rather inefficient way to carry carbon dioxide, but it does occur. Respiratory pigments. Respiratory pigment is a molecule that involves in transport or storage of respiratory gases. And human hemoglobin that increase the oxygen carrying capacity of the blood, and the myoglobin that stores oxygen in muscle are referred as respiratory pigments. Hemoglobin. Hemoglobin is the iron content in the red blood cells of almost all vertebrates. Hemoglobin in the blood carries oxygen from the respiratory organs, lungs, or gills to the rest of the body, the tissues. Here, it releases the oxygen to burn nutrients to provide energy. This energy is used to power the functions of the organism and collects the resultant carbon dioxide to bring it back to the respiratory organs to be dispensed from the organism. Myoglobin. Myoglobin is an O2 carrying protein that binds and releases O2 with changes in the cytoplasm of muscle cells. When your respiratory tract is exposed to an unhealthy atmosphere, it is likely to become infected by various organisms. The infections may occur in upper as well as in lower respiratory tract. Most common problems of upper and lower respiratory tract are given below. Sinusitis, upper respiratory disorders. Sinusitis is an inflammation of the nasal sinuses that may be acute. Symptoms last 2 to 8 weeks or chronic symptoms last much longer. The sinuses are holes in the skull between the facial bones. There are four large sinuses, two inside the cheekbones, the maxillary sinuses, and two above the eyes. The frontal sinuses. Sinuses are lined with membranes that secrete antibody containing mucus, which protects the respiratory passages from the irritants in the air we breathe. Causes and risk factor of cyanosis. It is usually caused by infection, bacterial or viral, but can also be caused by allergic reaction, dust, pollen, etc. Environmental agents such as excessive dryness in homes and offices from dry air, heating, and air conditioning system can also inflate the sinuses. Symptoms of sinusitis. The classic symptoms of acute short-lasting sinusitis are fever, nasal obstruction, pus-like purulent nasal discharge, loss of sense of smell, facial pain or headache, entering of nasal fluid into pharynx. Treatment of sinusitis. If a bacterial infection is present, antibiotics or sulfa drugs are usually prescribed. Anti-allergic and decongestants are also used for treatment of sinusitis. Otitis media. Otitis media is an inflammation of the middle ear. The eustachian tubes equalize the pressure between the middle ear cavity and the outside mucus to drain out of the middle ear cavity. Inflammation of the middle ear causes the tubes to close, causing the fluid to become trapped. Bacteria travel from the back of the nose through the fluid in the eustachian tube directly into the middle ear cavity, multiply in the fluid. Causes and risk factors of otitis media. Children are more commonly affected than adults because of the small size and horizontal position of their eustachian tube. The four main causes of otitis media are allergy, infection, blockage of eustachian tube, and nutritional deficiency. Symptom of otitis media: sudden severe rash, deafness, and tinnitus, ringing or buzzing in the air, sense of coolness in the air, irritability, fever, headache, a change in appetite or sleeping patterns, fluid leaking from the air, nausea, difficulty in speaking and learning. Occasionally, the eardrum can burst, which causes a discharge of pus and relief of pain. Treatment of otitis media. Around 80% of cases of otitis media clear up with 3 or 4 days without treatment. Perforated eardrums also usually heal on their own without the need for treatment. However, for complicated cases, following treatment options may be taken into consideration. Antibiotics may be prescribed to treat severe cases of middle ear infection or cases that get worse after 2 or 3 days. Painkillers may be used to control the main symptoms of middle ear infection, pain, and fever. Pneumonia. Pneumonia is a serious disorder of lower respiratory tract which is characterized by inflammation of alveolar wall and the presence of fluid and pus, alveolar sacs of one or both lungs. Causes and risk factors of pneumonia. There are over 30 different causes of pneumonia, but usually pneumonia is caused by bacterial infection, including mycoplasma and viruses, which can enter the body through the mouth, nose, and eyes. If the body resistance is down, the natural immunity against diseases is weakened, then microorganisms are free to spread into the lungs. Thus, alveoli become filled with fluid and pus from the infectious agent, making it more difficult for the body to get the oxygen it needs and the person may become sick. The bacteria that cause bacterial pneumonia are Streptococcus pneumonia, Haemophilus influenzae, Legionella pneumophila, Staphylococcus aureus, and Mycoplasma. If pneumonia is not treated timely, some complications may arise that include pleural effusion, fluid around the lung, emphysema, pus in the pleural cavity, hyponatremia, low blood sodium, and rarely an abscess in the lung. Symptoms of pneumonia. Symptoms vary depending on type of pneumonia and the individual. With bacterial pneumonia, the person may experience shaking, chills, chattering, teeth, severe chest pain, very high fever, sweating, rapid breathing, rapid pulse rate. With viral pneumonia, the person may experience fever, dry cough, headache, muscle pain, and weakness. These flu-like symptoms may be followed within 1 or 2 days by increasing breathlessness, dry cough becomes worse and produces a small amount of mucus, higher fever, bluish color to the lips. With mycoplasma pneumonia, the person may experience violent coughing, attacks, chills, fever, nausea, vomiting, slow heartbeat, and breathlessness, bluish color to lips and nail beds, diarrhea, and muscle action. Treatment of pneumonia. Treatment depends on the severity of symptoms and the type of organism causing the infection. Mostly antibiotics are prescribed. Tuberculosis. Tuberculosis is a highly contagious chronic bacterial infection of lungs. TB infection begins when the mycobacteria reaches the alveoli, where they invade and replicate within the phagocytomes. Vacuole formed as a result of phagocytosis of alveolar macrophages, but they are unable to digest the bacterium. Causes. TB is caused by the Mycobacterium tuberculosis that is transmitted from person to person by airborne droplets. Usually, this infection is passed on as a result of very close contact, so family members of an infected person are endangered. If the person continues to live in the same household and has not undergone proper treatment. Risk factors for TB include the following: HIV infection, low socioeconomic status, alcoholism, homelessness, crowded living condition, diseases that weaken the immune system, migration from a country with a high number of cases, and healthcare workers. Symptoms of tuberculosis. You may not notice any symptom of illness until the disease is quite advanced. Loss of weight, loss of energy, poor appetite, fever, a productive cup, and night sweats might easily be blamed on another disease. Only about 10% of people infected with Mycobacterium tuberculosis ever develop tuberculosis disease. Many of those who suffer TB do so in the first few years following infection, but the bacillus may lie dormant in the body for decades. Treatment of tuberculosis. Tuberculosis can be cured by a course of antibiotics taken over several months. Ionized and rifampin are the most common drugs used for TB. Inexpensive, effective, and easy to take. This can prevent most cases of TB. The disease can also be prevented by vaccinating infants with BCG vaccine, isolating infectious patients, improving hygienic condition and housing, using pasteurized and properly boiled milk. Emphysema. Emphysema is lung disease which is characterized by shortness of breath with exertion, eventually breathlessness all time, coughing, fatigue, cyanosis, a blue tint to the skin due to lack of oxygen. The exchange of oxygen and carbon dioxide takes place in the small air sacs of the lungs. Alveoli in a person with emphysema, the alveoli are damaged. The main tubes leading into the lungs, the bronchi, are also damaged and narrowed. The airways of the lungs are elastic. After repeated exposure to chemical irritants such as cigarette smoke, the alveoli and bronchioles lose their elasticity. The movement of oxygen from the air through the blood becomes more difficult. Emphysema is generally caused by cigarette smoking or long-term exposure to certain industrial pollutants or dust. Lung cancer. Lung cancer is one of the most common cancer in the world. Cigarette smoking is one of the major causes of most lung cancer. The more cigarettes you smoke per day and the earlier you started smoking, the greater is the risk of lung cancer. High level of pollution, radiation, and asbestos exposure may also increase risk. Common symptoms of lung cancer include a cough that does not go away and gets worse over time, constant chest pain, coughing up the blood, shortness of breath, repeated problems with pneumonia or bronchitis, swelling of the neck and face, loss of appetite or weight loss, fatigue. There are many types of lung cancer. Each type of lung cancer grows and spreads in different ways and is treated differently. Treatment also depends on the stage or how advanced it is. Treatment may include chemotherapy, radiation, and surgery. Effects of smoking on the respiratory system. Effects of tobacco smoke on the respiratory system includes irritation of trachea, windpipe, and larynx, voice box, reduced lung function and breathlessness due to swelling and narrowing of the lung airways and excess mucus in the lung passages, impairment, impairment of the lungs clearance system, leading to the build of poisonous substances which results in lung irritation and damage. increased risk of lung infection and symptoms such as coughing and wheezing, permanent damage to air sacs of the lungs. Key points about respiration. For effective diffusion, the respiratory surface must be permeable, thin, possess a large surface area with good blood supply and good ventilation mechanism to maintain a steep diffusion gradient across the respiratory surface. Respiratory system consists of nose and nasal cavities, pharynx, larynx, trachea, bronchi, bronchioles, and alveoli in the lungs. Lung volume and lung capacity is referred to the volume of air associated with different phases of the respiratory cycle. Normally, breathing in N is an involuntary process and is not controlled consciously. However, some voluntary control is also possible during voluntary control impulses originate from the cerebral hemispheres and pass to the breathing center. Breathing consists of two phases, namely breathing in or inspiration and breathing out or expiration. The blood transports the oxygen from the lungs to different tissues and carbon dioxide from tissues to the lungs. Approximately 97% of oxygen is carried by the red blood cells as oxyhemoglobin, while 3% is transported as dissolved oxygen in the plasma. Carbon dioxide is transported in the blood in three main ways: in the form of bicarbonate ions, in the form of carboxyhemoglobin, and dissolved in plasma. Approximately 70% of carbon dioxide is carried in the blood as bicarbonate ions. About 23% of carbon dioxide is carried as bicarboxyhemoglobin, only 7% of carbon dioxide by the plasma. In human, hemoglobin that increases the oxygen carrying capacity of the blood and myoglobin that stores the oxygen in muscles are referred as respiratory pigments. Sinusitis is an inflammation of the nasal sinuses. It is usually caused by infection, bacterial or viral, but can also be caused by allergic reaction, dust, pollen, etc. Otitis media is an inflammation of the middle ear. Pneumonia is a serious disorder of lower respiratory tract which is characterized by inflammation of alveolar wall and the presence of fluid and pus in the alveolar sacs of one or both lungs. Tuberculosis begins with the mycobacteria reach the alveoli where they invade and replicate within the phagocytes of alveolar macrophages, but they are unable to digest the bacterium. Emphysema is a lung disease in which the alveoli are damaged. It is generally caused by cigarette smoking or long-term exposure to certain industrial pollutants or dust. Lung cancer grows and spreads in different ways, and its treatment depends on the stage or how advanced it is. Treatment may include chemotherapy, radiation, and surgery. Again, sinusitis is an inflammation of the nasal sinuses, and it is usually caused by infection, bacterial or viral, but can also be caused by allergic reaction, dust, pollen, etc. Otitis media is an inflammation of the middle ear. Pneumonia is a serious disorder of lower respiratory tract, which is characterized by inflammation of alveolar wall and the presence of fluid and pus in alveolar sacs of one or both lungs. Tuberculosis begins when the mycobacteria reach the alveoli They invade and replicate within the phagosome of alveolar macrophages, but they are unable to digest the bacterium.